Go. All right, we are back for episode 9 today of the Minnesota Due Process Coach, and I am very excited. I got to get a new line. I say that every single time. I said that last episode. I was like, God, I always say the same thing, but maybe that's like my hook that people have like a song, and I'm like, and I'm so excited. But I'm so excited today to be joined by my very good friend Ashley, who is a social worker within a county. I don't know if she wants to say it here. She doesn't have to. Nearby here in Minnesota. And I'm excited to have Ashley here today because she has a wealth of knowledge around the school truancy process, which I think is huge for us in special education, and a really big topic that I've been wanting to talk about and I've had some feedback on, which is children's mental health, which is also a really big topic here in Minnesota and within our school systems right now of how that's affecting our students, how that's honestly affecting truancy and absences and getting kids to school and all of these things that directly tie into special education. And I think outside of special education, this mental health, I almost want to call it a pandemic within our kids, and what that kind of looks like. So I'm gonna have Ashley introduce herself here and kind of give us a little background about what she does, her history of her career, whatever whatever you want to share. But Ashley, you can take it away.
All right, thank you. So again, my name's Ashley. I have done truancy with the county for almost actually 11 years this week.
That's crazy.
So I can't believe I've been in one position with the county for 11 years, but here we are.
That's probably a really long time. Like when you think of like county years, like dog years, like somebody
Yeah,
surviving in that position for that long. That's cool.
yeah. And how much it's evolved. So it used to be just me, just one person doing the entire county taking on truancy. So my caseload used to be like upwards of 80 clients every single school year. And now there's two of us. So, we're managing it a little bit better, but within the past 11 years, it has really changed with the clients we see and our processes and all that kind of stuff. So I'm excited. I like truancy. I love the school system, and here we are.
Yeah. So actually you work directly with the schools, correct? So you are kind of that
Yes,
that partner to the school with the county, correct?
absolutely. Yes. And we, for the most part, just work with our truancy kids, which is our 12 through 17 year
Mm,
olds. The younger ones, 7 through 11, is ed neglect, and they go through our child welfare, our child protection system.
okay.
So we don't see those kids. It's strictly the truancy piece, which is those unexcused absences for older kids.
Okay, that's an interesting thing to think about. I didn't actually know that there was two separate pieces here, the ed neglect, like you said, which is welfare,
Child protection.
child protection, which does make sense because sometimes I feel like that process takes a long time when we're thinking of schools, but there is a lot that goes into that and the things that they have to do. And then the 12 to 17 moves into something completely different, which is ed neglect that you and your partner at the county handle.
Yeah, so that's truancy. So the
Truant.
younger is ed neglect, the older is truancy. And ed neglect looks more at the parent, and the parents are getting in the way of their child's education. Truancy is we always say you need a parent component, right? Kids still need a parent 100% of the time, but the
Okay.
kids are old enough to take some control of their own attendance.
Nice.
And so that's what we're looking at with our truancy piece.
So you're working more with like the students, obviously, and the family, but more of like making those plans of how to like facilitate to get them there more independently on their own, right? And not so much on the family.
Absolutely. Yep.
So I think a good question would be is that what have the numbers looked like since COVID, right? Because I feel like that was a huge impact on a lot of our students and obviously the way that we looked at school and how things worked. And during COVID, the rules were, I feel like, a little bit different because we had a lot more stipulations that went with that. And to now, like, what is that? Have you seen a shift? Has there been a shift? Is there been an increase or a decrease within what you're seeing in that in the truancy pieces?
Yeah, great question. So we've seen a huge increase in our truancy numbers after COVID because the school avoidance and just the comfortability of staying at home has
Mhm.
really increased. So we've had to um, hone in our guidelines for what for the kids that we accept on truancy because for two of us we just don't have the manpower to effectively work with all kids. What
Yeah.
we don't want to do is surface level truancy, which is what we do if there's a lot of kids on our caseload. So we've had to um, tighten up the kids that we take. So we no longer take kids that are just in school, but they're skipping. So we call those in-school skippers. And
Mm.
we don't take kids that are over 17 anymore because at 17 years old, parents have the ability to unenroll their kids. So we just don't take 17-year-olds anymore. Because of that, our numbers have decreased, but our needs within our cases have really increased. So we have a lot more middle to high risk kids as opposed to middle to low risk kids. So
Okay.
though those numbers, our intensity of our cases has really increased since COVID.
Do you think that intensity does play into that mental health for these kids not able to get to school, or there's just these other factors happening? Or what are those things that you're seeing that are making those situations more intense per se?
But definitely the mental health. The mental health with these kids, the anxiety, the depression, the school avoidance, we
Mhm.
are seeing that play out in the kids that we're working with almost with every kid that we have on our caseload.
Okay.
And so figuring out what is the mental health piece, what needs to happen? Can we work on that within the school setting? Do we have to refer them to a higher level of care? What does that look like? So we are really working within that mental health system and trying to figure out the best services to meet these kids' needs so they can get back to a regular school setting all the time.
Okay. So can you walk us maybe through like one of those plans that you might have for like a student that is struggling with a lot of mental health, and like what are those services or those options that you offer to those families and those students?
So we always try to do least restrictive first.
Yeah.
So we always say, Ken, let's start with a DA and let's get a professional in there to help us figure out what do you need, and is it outside therapy one time a week? Is it therapy within the school settings? We start with those situations. If I have a student right now that just is struggling getting to school, so we looked at a day treatment within the school
Mm.
setting. That wasn't working because she got to the diagnostic, she got to those meetings, but then when she got there, she didn't qualify for their services. So then we're looking at, a PHP program, which is partial hospitalization with outside of the school setting. And so
Hmm.
now we've been working with that. It's been a whole year trying to get her into a setting that's going to really meet her needs. In the meantime, her education is lacking because her mental health isn't being serviced in a way that she feels good about learning, walking into a building, things like that.
Right. So are you working more in partnership with those families who probably aren't able to access or even know how to get those services for their students? Or do you feel like these parents do sometimes know what they need to do? They just don't always have the right resources?
Both.
Both.
A very, very mixed bag of both. And the insurance piece falls into it. So
Yeah.
a lot of times parents are willing, students are willing, schools are always on board, like, how can we help? And then
Yeah.
we get that insurance piece. And that is a huge barrier to getting services that kids need sometimes.
Right. So outside of, right, so you have this pocket of kiddos that isn't going to school that falls under with the truancy with you, and you kind of help facilitate those pieces for them, which is really great. But what about those kids that aren't truant, right? That are going to school sporadically, kind of, I hate to say playing the game, but there is a little bit of a game that that we all know some of our students play of, I know if I go this many days and then I don't come this day, but then I'm back, I won't fall under that, which is crazy that they know that. But what about those kids? Are there services that the county offers or has, or that parents have access to for these mental health services?
So as far as like kids kind of playing the game, like when they choose to come to school or not, they would
Mhm.
still fall under truancy. So truancy
Oh,
qualifies for kids if they miss 7 days of school unexcused. And what
Mm.
we're looking at is really 7 mornings. So we're not even looking at full days. So if they come to school late,
Oh,
if they leave the school building, that will count for us as those unexcused absences, and it only takes 7. So then we look at behaviorally. So is this a behavior concern, or is this a medical mental health concern? So to weed both of those out. So for the behavioral concerns, we look at some more punitive approaches like assigning community service or
oh,
night school or summer school. Some kids I put on house arrest because they are making unsafe choices and we don't know where they're at during the school day or in the evening. But we want to keep kids in the home. We always look at mental health and chemical health to weed out both of those concerns to see what is the big picture, what else is going on with the school attendance.
yep.
And sometimes we even go to court. Like we've had to go to court with some kids because we just can't get them into school. There's a huge safety concern, and that's just kind of where it leads us. So we try to avoid court, but there are some cases that are so
Extreme.
thank you, so extreme that's where it has to go.
Yeah, no, I can see that. Interesting that you brought up the chemical health piece of it because I see both sides of it. In one of my districts, we have a really big chemical health issue, right? Of a lot of kids using, and that is directly playing into their education and their ability to get to school. And when they are in school, whether they're fully present with us, and if they're all of those things. And then there in my other district, it does come down to that more of that mental health. And like we were just talking about before we started, going to school, getting there, but not actually going. And I thought it was really interesting, and I wanted to bring this up because this was a good conversation we had. We should have been recording. Um, was this piece of kids that they go to school, but they get there and they're skipping classes within that. And I thought it was really interesting that you said that that falls on the school, right? And not on the county anymore, which I firmly agree with, because I think if they're within your building, then we should have plans and procedures in place of how we're getting them to go to class. Because that does directly relate into special education services for a lot of these students. If you're looking to qualify, right, there is that absences play into our factors for SLD, and whether they're going to school consistently, whether their attendance has been, consistent throughout the years. But I think it is interesting because I think there's this piece of, well, we got them to school, they're here, but now how do you get them to go to class? And you did say in one of your buildings they do hallway sweeps. Are there any other things that you've heard of that you feel like have worked for some of the schools that you work with, other than like the hallway sweep or other things?
Yeah, some schools do escorts where
Mm,
they will have one of their house supervisors escort a student from class to class, which
mm.
I think has been helpful. But nobody wants an escort, so
No.
they try to avoid an escort. But once they get an escort, like, oh, okay, this isn't so great.
Yeah.
So they have an escort. Sometimes I've had a school do a no pass list
Mm,
where once you get to your class, you can't leave. And if you have to go to the bathroom or go someplace else, then we call a house supervisor and they have to walk you to wherever you have to go.
mm.
So a no pass list has been pretty impactful as well.
Yeah.
I do know some schools or one school had talked about letting a parent come in and escort their kid to and from the classes.
Wow.
Um, I don't know how impactful that's been, if it's more
Yeah.
distraction or if it's really impactful, but I know that that's been
Yeah.
thrown around a few times too, is just getting these kids to point A to point B.
Yeah. So just to back up a little bit too, so after seven, it's interesting you said that. Sorry to jump around squirrel brain here. That after 17, and it's so funny that when you said that, I was like, that is crazy because a couple weeks ago, one of our social workers said to me, because I was like, this attendance is so bad. Like, what are we doing? Like, what's going on? And she's like, they're over they're 17, Christine. Like, there's nothing that we can do. And that is like mind blowing to me. But when you said that they could unenroll, that made sense. And so, do you see a lot of that like after 17, like the unenrollment, or just like or anything in regards to the attendance or the truancy? Or I guess maybe you don't see it because you aren't as involved in that anymore?
Yeah, we don't see it. We do know that for some of our kids, that are hitting that 17 mark and they're just really struggling, we do talk to them about like, yes, parents can unenroll you. Here's a GED, here's a career force that you can
Right.
go to when you choose to afterwards. Here's job course. We give them information, but
Mhm.
once they turn 17, if they are not on track to graduate, they really have no interest in extra support and getting to school, being
Yeah.
educated. We close their case. So I don't always fully know what happens. There's been a handful of kids that I worked with that I've physically seen their parents unenroll them. But for
Hmm.
the most part, unfortunately, like we do close their cases before that even happens, but they're on the trajectory to be unenrolled.
That's so interesting, but it makes total sense now because I was just, I remember when they said that to me, I was like, that's not possible. So it must be, is that something that's obviously statewide or is that
Yeah.
something? Okay.
Yeah, it's a statute that 17 years old, parents can unenroll. Students can't do it themselves.
Hmm.
So parents have to do it. Once you're 18, you can unenroll yourself. But by 17, some parents are like, you know what? We fought the good fight. We love
Yeah.
you, and we understand this is just not where you're at right now.
Right. No, for sure. Let's dive into the mental health piece a little bit, if you don't mind, just because I think
Yeah,
it would
please.
be a great topic. So, obviously, been this huge rise in mental health, and not just within that 12 to 17 age range. I think I see, honestly, a lot more of it in the younger age ranges. But I'm just curious, like, where I don't even know where to go with this question, or maybe it's what are some resources that are out there for families through the county for mental health, if there are any, or are there steps or I don't know. I know where would a family even start, right? Maybe that's where we come back to
Yeah.
because I feel like from the district standpoint, we do certain things, but there's only so much that we can do in a school system, right? Like we really can't be recommending these outside PHP placements because then districts obviously have to pay for them. So it has to come from the county or from the family. Sometimes getting into prairie care is really hard. And what does that look like for them? Sorry, this is like multiple questions I feel like on one, but what are those first steps that you would encourage for maybe a family that is struggling, or even like us as educators of what we could do to help start bridging that? Because I don't know how often that families know, unless they're already connected with the county for other resources, that there is help out there for them.
Yeah. Great question. So one of the things that we have that we've seen obviously a spike in services or spike in need right now is our children's mental health case management. So we call it our CMH services, which is
Mm,
a voluntary program offered by the county where you work with a social worker and that social worker helps families and youth navigate the mental health system. So
okay.
they help, research best services for this family, help look at recommendations, help with funding. So we don't actually pay for it, but help
Yeah.
them navigate their own funding source and system. And so that's a voluntary program through the county, and we have a lot of referrals for CMH.
Mm,
And that's for any student, for any child
okay.
that qualifies and has a diagnostic and a
Does that come through through the district then? So does the district refer them, or can a parent make their own referral?
So a parent has to make the referral, either a
Okay.
parent or a
Oh,
mental health professional has to make the referrals. What we were seeing happening was that schools were making a lot of the referrals. And then because it's voluntary, we would call the families and say, like, we have, we got this recommendation or this
yeah.
referral. And they'd be like, I don't know who you are. I'm not talking to you. I don't want this service. So we'd have to open and close a lot of our cases.
Right.
So
Oh,
now we ask that either families or mental health professionals can make that referral.
okay.
Sometimes schools, if neither one of those, if they're not a mental health professional and families like, I just don't really want to do this, but they're missing classes. So they're seeing the mental health is directly impacting their attendance. A
Mm,
lot of times for our district or for our county, they'll call a truancy or pre-diversion meeting where me or my coworker come in and we meet with the families in the schools and talk about what kind of services can be provided.
okay.
And if they choose not to do CMH, absolutely fine. That's within their right.
Yeah.
And their kids still need to go to school.
Right.
So if it's still impacting their ability to get to the school building and choose not to do anything about it, then that still qualifies for truancy. So then
Okay.
we still get involved, and truancy is not a voluntary program. So we can't close their case until we see positive success over time.
Oh, that's interesting to know.
Mhm.
So
Yeah,
what
so
is
some
that?
school districts close or some counties close all their cases at the end of the school year. We do not. We keep our cases open throughout the summer into next school year and work with these families until they've made enough progress or unfortunately age out of the program.
That's amazing though.
Yeah.
I mean, what a great level of support because I do like what you said. I feel like sometimes it's just like, oh, the school year's done. We're
Yep. Try
moving
again
on.
next year.
Yeah, well, hopefully it gets better.
Yeah.
So do you find that there's things that you do in the summer with these families at all, or is it kind of like a break, or are there services that you're still providing?
It's both. Some kids I'm strictly continuing to build that rapport with and really talking about what's going to happen next year and really start talk about what can we do so that your case can close and you can be on a better path next year. Some kids, it's that summer school aspect. What you need to do in summer school, this will go towards your truancy. If you go to summer school, I'll take off a few weeks at the end of your truancy. And other kids, it's those services, so those mental health services. So let's dig in deep in the summer, really
Yeah.
work on this mental health piece, get you some tools, get you some services that when you start school again in the fall, you are better equipped to manage the school setting and not be, the PHP, the IOPs, things like that. So
Yeah.
it really depends on a case by case basis, but we're definitely not just hanging out and, hey, we saw you, have a good summer. There
Right.
usually are some things that we're working on, which aren't always as intense as during the school year.
But maybe you can access more services in the summer too, right? Like just because
Yes.
schedule is a
Yeah.
little bit.
So for our kids with mental health struggles, we really dig into those mental health pieces in the summer.
Yeah. Do you find that everything is different county by county?
Absolutely.
Yeah.
Yes. Yeah. So there's, one statute, but there's always screening guidelines, and every county has their own screening guidelines for
Oh,
the cases that they accept into their county. And like we were talking about earlier, some counties have outside referrals and outside agencies that manage their attendance and mental health, and then comes to the county. So yeah, every county really manages attendance and truancy different.
that's so interesting because I think of, and you'll know this too, of how many kids move between counties.
Yes.
Right? And I mean, I've seen that in my school career, watching a family leave mid-year or start a different place each time in a different county. And that's an interesting piece to think about too, like that each one they go to offers different services. And do you find, and I used to see this as it takes a while to find those kids again, like so say you have one that's in your county and moves to another one, do you often feel like you can pick up with that other county really quickly, or is there like a lag time in that kids aren't getting those services and maybe they could be? I mean, every county has different amounts of workers within them and their capacity and their ability to do things, but sometimes I do worry that's how some kids get lost and, you know, um, lost in the transition of moving from those places.
Yeah, absolutely. I think it does take a while to figure out who those students are. Again, if we ever do,
Yeah.
because every school tracks attendance different. Every county accepts truancy and ed neglect differently. And some are, online through the computer referral, some are phone calls, some are forms. So even the referral process from county to county is different. So it does take a while. What we're doing on our end at the county is that we have one truancy collaboration committee that we started probably like 9 years ago. And so a bunch of us that do truancy and attendance within different counties come together one time a month
Oh,
and we collaborate for an hour and a half meetings. And we talk through the different county processes. So we have face-to-face meetings, we just get to know the processes better. And so
yeah.
if I have a student going to a neighboring county,
Mhm.
if I'll get a release sometimes and talk to that other county and be like, I know exactly who to call. I know who does truancy there. I'm gonna talk to them before this case goes over there.
Yeah.
So the collaboration between counties has been really nice to know who does truancy and how their truancy processes play out.
Right. Yeah, because I mean, they could go somewhere and just get lost in the mix again. And I say that too about anything with like students that were like I say to a lot of the teachers that I coach, if they notice something is wrong or they have an inkling or something with families or there's been an attendance issue, I'm like, it doesn't hurt to call, right? It doesn't hurt to at least start the process because you're not going to feel great later when you probably could have called or you should have called, but you were like, well, because I think there is a lot of that's hard for educators is that feeling of, well, I don't want to get anyone in trouble or I don't want to do anything. And I see that a lot with my new teachers. And I say to them, yeah, but you don't want anything to happen to that student, right? Because maybe it seems like something small, but it could lead to multiple other things or even attendance. I was just talking about attendance with a teacher the other day, and they were like, well, he still comes, but he's coming at 10 o'clock. And I'm like, still truancy, like, and just think of all the progress he would make if he came at the correct time. So it's like the county is there to help people. And I think that's the other piece too is for so long, I think sometimes people have had the wrong impression of the county. And I don't know if you see that too, of I'm sure, right? That the county is just going to come in and they're the big bad, I hate to say it
Mhm.
that way, but
Yeah, no,
they're
you're
gonna,
right.
yeah, they're gonna take my kids away or they're gonna do this. And I always say to families, yes, there are those pieces if you're not doing what you're supposed to be doing, but the county has so many resources and so much help they could provide you or at least guide you to that I encourage them constantly to reach out, especially when it comes to mental health. Like, what can the county do? Or could you call the county and see? But just like you were saying, that program that you have, I mean, that would just be a lot for families just to be able to learn because not everybody understands the process. I don't even understand the process. And I'm in education. I don't even know if I would know where to begin. Um, and especially if you're a family that's in crisis already having someone help you or guide you or at least give you resources, I feel like would be huge because I do think it all starts with families, but the families are in crisis themselves, just trying to survive with their students or whatever their students are battling. And I also think mental health, and I think you could probably speak to this too, looks a lot different now than it did 11 years ago,
Absolutely.
and I mean, I started my educational career, oh God, like 14, 15 years ago. And even from there till now, the children's mental health is night and day different. And I don't know what it's from. I'm not sure if you have any ideas. I don't know if I do. I mean, I think I have a few, but more like personal opinions, but
Right. Maybe we won't go there.
yeah, we probably shouldn't go there. No, but I do think there is so much more now than there was before. And I mean, you could probably speak to that too from the beginning of your career until till today. The things that you're probably seeing of kids in crisis looks different. And how you guys are, do you feel like as a county you guys are serving them different because of this uptick in the mental health, or do you feel like you've kind of continued with the way that I mean, more like progressively moved with how the services need to happen, but just thinking it back to your, beginning to where you are now, any of those differences that you might think of?
Yeah. I mean, it was definitely more of a black and white template when I first started. And
Yeah.
it was you do this, you get community service. You don't do community service, this happens. So it was more of a checkbox of like
Yeah.
this is the process. And I don't have time to really delve into all your individual needs. So it's this and I have to move on because I was
Oh,
just me and I was so busy. And I would meet kids one time a month. And that was really it.
wow.
Now I'm meeting kids on almost a weekly basis sometimes. And we are delving into their family system, their school system, their friends, their mental health, and figuring out what is the root cause of what's happening.
Yeah.
And so we are really taking a more like systemic or bigger picture approach as
Yeah.
opposed to like just go to school and we'll figure out the rest later.
Yeah.
It's what's happening that you aren't getting to school and delving into that with families and extended networks and what kind of safety is in play and all those different things.
Yeah.
So it's a much deeper rooted process that we're in right now. And we really look at mental health and chemical health almost right off the bat for any student that we work with. instead of more of the behavioral process of, nope, community service, house arrest, court.
Yeah. Well, I think too, just when you said that, it's like it probably was more behavior back when we started, whereas I think now more it is that anxiety.
Yep.
It's the mental health of not being able to get out of bed or be able to get out the door. I mean, I've even seen kids get to school and not get out of the car. I mean, so it looks so different than just I'm not going. Which I think is what people think, right? When they think of truancy or ed neglect is the kids just at home going, I'm not going to school, which mind you, there are some kids like that we all know, but I think there are more kids that are struggling with all of those mental health pieces around actually getting physically there and getting over that
Yeah.
hump.
Yep.
Um,
The building is just so hard and so real. And
yeah.
those real feelings come out as real physical symptoms. So that, sometimes they shake and sometimes they vomit and they physically can't move. And so those are real feelings that I didn't always see in the kids that I would work with a few years ago for a few reasons, right? Like our caseload is different now. We have more time to delve into the bigger picture, but there is certainly more anxiety walking into a school building than there was 11 years ago.
Yeah. I mean, I think a big piece of it is social media, right? Like, and
Yes.
you know,
Phones.
especially with girls. Ashley and I have girls who are very good friends and have been since they were little. And I think social media plays such a big piece into it. And I shouldn't just say it, girls, boys too. And, phones and all of those things that weren't as prevalent back when we first started and that play such a huge role in these kids' lives now.
Yeah. And how they feel about themselves and their self-worth and being included and being worthy enough. It's all real. It's all right there in their face all the time.
Which is just so much. They should have
Yeah.
like social media courses for kids sometimes, I think, and it's offered somewhere. I don't know. Maybe for
Every
me.
year. So it's
Yeah.
ingrained in their mind every single year.
Yeah, totally. Uh, well, Ashley, it's been so great to chat with you, and I really appreciate you coming on today. Did you have anything else that you wanted to share or anything for the group? Put you on the spot.
Yeah. I think some of just the biggest things are what you already talked about is like the county does always sound like a big and scary beast, right?
Right.
But everyone that I work with truly does have kids' best interest at heart. And we do want to collaborate with the families.
Yeah.
And so if there's a family that's struggling, with mental health, substance abuse, and it's impacting their, for me, like their attendance, like get us in there right away.
Yeah.
Let us help. Let us try to help in the beginning of the school year as opposed to like this time of year
Yeah.
when we get referrals and all of a sudden they have, oh, this kid has missed 30, 40 days of school. Like, what? It's at the end of the year. Like, what are we gonna do?
Right.
So
Yeah.
let us help earlier and younger in the school years, like those middle school years, early high school are huge, impactful years. Once we get to the 16, 17, we have a tough time really making a lot of progress with some of those kids.
I think that's a good point that you made, really collaborating with the families. And I would say I really encourage all my teachers to collaborate with the county for anything. They'll be like, oh, they have a
Mhm.
county worker. I'm like, well, have you called the county worker? Have you talked to the county worker? Have you invited the county worker?
Yeah,
They're
yeah.
like, well, and I'm like, you should. Because the more you guys know, right, the more that you can help the family outside of like what we can help them in education. Maybe there's things that you have that we can't offer. And I think really just continuing that collaboration, if the family has county services already, right, with you guys early and often, um, and really encouraging that for families too.
Hmm. Yeah,
Like it.
I agree.
Awesome. Well, I'm so happy you could join us today. Hopefully you'll come on again in the future. Maybe you want to do this again. I don't know. Some people are like, oh, one and done, Christine, but it was really great to have you today. And if anyone has any questions for Ashley, you can drop them in the comments of the video and we will be sure to get them to her to answer um, for the next time or just here if there's anything you need moving forward. All right. Thanks, guys.